Thank you, Allison, for that warm introduction, and also to Siemens and the American Hospital Association for bringing us together to have conversations on unlocking the barriers to sustainable healthcare. So what is sustainability? This is a conversation we have been having quite a bit this morning, and we have learned about different elements of sustainability. And what I've come to understand is sustainability means different things to different people. Whether it is a focus on energy efficiency using alternative modes of energy, or it is a focus on governmental policy and how that impacts what we're able to do within our facilities. It has a different relationship to each of us. As an engineer, I was trained to think in a process-oriented, logic-based mindset and to design integrity into the projects I work on. How I came to first understand sustainability was through a set of equations. And I'd like to share with you some of those equations. The one thing I will say, though, is at the intersection of environmental sustainability and healthcare, I have found the greatest opportunity to impact large-scale change based on the principles of sustainability. So the first equation is sustainability is not about tree hugging. It used to be that sustainability or conversations around the environment were synonymous with somebody who was wearing Birkenstocks and who was on a quest to stop deforestation. And while those issues are still extremely relevant and important, that is no longer the framework in which we have conversations around sustainability. Sustainability has also been defined as the intersection of people, planet, and profit, also known as the triple bottom line. And this is where we're finding new ways and new innovations and ways we can operate our facilities and lead our facilities to finding a path to continuing forward while finding a balance within the environment. However, I think there is a conversation and an equation that is much more relevant and much more important today, and that is sustainability is equal to health. Historically, the conversation around sustainability was around the impact we're having on the environment, whether that was what we were doing to our water systems or what we were doing to our trees and our forests. However, the conversation has really shifted to be the diametric opposite. It's a conversation now about the impact the environment is having on our health. And as healthcare leaders, this conversation is becoming especially important, and we have an opportunity to really lead the way in environmental sustainability. And this is nowhere more relevant and important than looking at our most vulnerable populations, and that would be our babies, our children. There was a recent study done called the Body Burden, where 10 newborn babies, randomly selected, not predisposed to toxic concerns, were tested, their core blood, before a baby had even had an opportunity to take their first breath. And what was found was truly disheartening. Over 287 chemicals were found in the core blood of these babies. These are chemicals that are not routinely found in humans. This includes items such as mercury, brominated flame retardant, pesticides, and other environmentally concerning chemicals. Additionally, this is now propagated into the way that we deliver care. The American Academy of Pediatrics has recommended to its 60,000 pediatricians that they now become familiar with the adverse health effects of chemicals in the environment. And also, not to be overlooked, is a report from the President's Cancer Panel. And in this report, it highlights that the true burden of environmentally induced cancer has been grossly underestimated. So this is where the conversation is now about how is our environment actually impacting our health. So let's take a look at our own facilities, at our own operations, and the way that we lead as healthcare leaders. Today, just like every other day in America, 6,600 tons of waste from hospitals will make it to landfills. Additionally, in this year, we will spend $10 billion on energy, and we will use 836 trillion BTUs of energy in the process. And through these processes, we will actually generate 8% of greenhouse gases. Now, this may be reason to pause. The healthcare industry is based on the principle and premise that first, we will do no harm. However, perhaps this is an opportunity for us to take a look at our own operations and the way that we're leading our facilities to really understand what our impacts are and how we are the anchor institutes for many of our communities and how we are leading the way and how it ties into our very missions. Unfortunately, there is another equation to consider, and that is the equation that population plus consumption is not equal to the resources we're currently using in our planet. This actually is the definition of being unsustainable. And there have been many different studies highlighting the rate at which we are consuming and different figures to support those. But ultimately, the fact that we are using more than we may need to use is where we have opportunities to relook at what we are doing. But the good news is there is a business case for sustainability in healthcare. The basis of that principle are based on the simple fact that when you waste less, you save money, you save more, and that actually also translates into money. But the business case goes beyond the simple metrics of dollars saved, which, by the way, are significant, including the $2.5 million that Inova has saved over the last 3 years in single-use device reprocessing alone from 4 of its hospitals. And oh, by the way, in the process, we also reduced 60,000 pounds of waste from our ORs. And this is really just one simple example. Another example could include the 1 million pounds of regulated medical waste we're able to reduce from our operations, and in the process, save $250,000 doing it. But this business case actually speaks to the new model of health. This new model of health is one in which we are actually focused on keeping people out of our hospitals. It is one in which we are reaching outside of the 4 walls of our hospitals, and we are working with our communities. This also means we need to consider how we're impacting the population health. A key example of this would be Inova's Buy Fresh, Buy Local program. And this is a program in which we are actually able to work with local farmers markets and match the first $10 of SNAP dollars, also known as food stamps. And this is a way in which we are able to help ensure healthful, local, sustainable food for our community members. And in the process, we're also having a positive impact on the economy of our local community. But most importantly, this really ties to attack the root causes of chronic diseases before they start. This new model of health is especially relevant in the way that we will be incentivized to perform not on fee-for-service, but fee-for-outcome. So sustainability is a way that you can reduce costs, increase employee engagement, and create positive brand value, all without cutting a single staffed position or a program. The business case further speaks to managing the many challenges that healthcare leaders are facing today. Over the last year, Inova's sustainability program has provided more earned media than almost any other service line or any other story or initiative that we have been working on. It was our sustainability efforts that put us on the panel at the White House. But more importantly, it is our sustainability program that our employees are really relating to, whether that is through our Blue Wrap fashion show, in which we partner with DC Fashion Week and our employees, as well as hospital employees across the nation, to make items for the runway out of surgical Blue Wrap, which would ultimately otherwise either be recycled or end up in the landfill, and use these opportunities to engage stakeholders in thinking of using materials in a new way and thinking of how they themselves can be engaged and how partnering with organizations can focus on different ways to reduce the impacts of the environment. So what can we do? What can you, as leaders, go back to your hospitals and start to work on And I think the answer to that is really looking at the demand-driven supply chain. We heard earlier today about the increasing amount of GDP that our American hospitals are using. Currently, the number that I've most recently heard is 18% of the GDP, or to put it in a dollar figure, $2.7 trillion. Now imagine if that force was actually used to propagate creating new products and new services that reduced our impact on the environment. And that, in essence, is the goal of the Healthier Hospitals Initiative. The Healthier Hospitals Initiative is a collective of 13 sponsoring health systems, many of which may be in this room today, that have come together and shared best practices with a goal to help make environmental sustainability ubiquitous in the healthcare industry, with a focus on 6 key challenge areas: engaged leadership, healthier food, leaner energy, less waste, safer chemicals, and smarter purchasing. And the goal of this initiative was to eliminate all barriers to being engaged in environmental sustainability and learn from those who have already started down the path. And oh yes, to make it free so that every hospital in America could be part of this movement, with a goal of having at least 2,000 hospitals commit to one of these 6 challenge areas over the course of 3 years. And we've made quite a bit of an impact. We are 1 year into the initiative, and we have over 800 hospitals committed to at least one of these challenge areas. We've also had the opportunity to share some of our great successes, including collectively between 370 hospitals reducing or diverting over 86 million pounds of waste from construction demolition programs related to major construction. So this is an opportunity for everybody to be part of this journey. So looking at how do we define sustainability, or how do we define value in healthcare? So value is equal to quality and safety plus the patient experience over affordability. Now, how can we translate this into creating some value around sustainability? So looking at what is quality and safety, it is a focus on process improvement. And that is really the base of a lot of sustainability initiatives. It's about reducing waste and finding ways to do things more efficiently. Looking at the patient experience, our community is our pool of patients. How we interact with these patients is really also how they see us and impacts their experience as patients in our facilities. And that, in essence, is related to community benefits. And when it comes to affordability, let's relate that to cost and the many cost savings we've actually been able to see through sustainability. So reframing the equation of value in terms of sustainability, it actually looks like process improvement plus community benefit over cost. And I will say that every sustainability project that we've been working on has had a high return on value. Most of these equations were learned through a process of co-authoring a book that focuses on the why of sustainability in healthcare. And it is focused and geared on relating this to a leadership imperative. Through this book, we actually went through a process of focusing on the top 10 key concerns for healthcare leaders, not related to the environment, but what were the top 10 things that kept leaders up at night. And part of this was through a process working with the CEO of Inova Health System. And then independently looking at what are the things and the aims that sustainability can help you achieve. And then to look at the intersection and realize that sustainability is a vehicle to achieve existing leadership priorities. So I shared with you that I first understood sustainability through a set of equations. But I learned what sustainability meant in the healthcare industry from a visitor of a very ill patient at one of the hospitals at Inova. And it was centered around an event that we hosted. It was our CEO chef cook-off. We host a local food Olympics, and this is where our CEOs battle for a top chef position with their family recipes featuring local sustainable foods. And I had somebody come up to me and asked me what all of this commotion was about and what was going on. And I was able to share with that visitor that sustainability was inherently a part of the value of the organization, and that it meant so much that the leaders themselves wanted to be part of this journey and wanted to be engaged in the process. And her reaction was contrary to what I had expected. She started to tear up, and a little baffled, she shared with me that she was visiting a very ill patient, and to understand that the leaders of this organization cared enough about their community and cared enough about the environment and healthfulness of the community made her truly appreciate and understand that the care that she was receiving, or the care that her friend was receiving, was taking place at the right facility. And that, to me, is how I came to understand that sustainability in healthcare goes beyond the equations. It goes beyond the millions of dollars that can be saved through the process, but it goes on to being an opportunity and a mission-based, value-driven engagement opportunity for all healthcare leaders to really highlight and to share that sustainability is about health. It is about keeping people out of hospitals and working upstream to eliminate and to eradicate chronic disease before they start by looking at what we can do from the get-go. So we heard from a lot of great speakers this morning, and tying some of the things that they shared with us together. We heard about optimism, and that is a place I stand from today, and a place where I'm optimistic that we are going to be able to change these equations, and most especially the one in which we're consuming more resources than we actually have access to in this environment. We heard about focusing on population health and understanding now, hopefully, that sustainability is that key to looking at some of these upstream solutions, whether that's focusing on energy, water, waste, environmentally preferable purchasing, or whether that is looking at how we can associate being leaders with our brand and creating a value for environmental sustainability. And most importantly, I think we have an opportunity today to come together and take the things we've learned from the conversations from earlier into what we do within our own operations, and from that, to be able to go back to our facilities and look at our own operations, as well as the way that we conduct our brand, our visibility, our positions of leadership, to one in which sustainability does mean health. Thank you.